Okay, hi everyone, and welcome to another week of reality. This is the podcast show where we talk to real people doing real things in very real situations. And, we kind of escape COVID in the last couple of weeks. And this week we've got a very special conversation to bring to you. We are going to be speaking to one of the incredible, amazing, just totally inspirational nurses working in Italy, dealing with COVID in northern Italy. So I'd like to introduce you to Mariella.
Hello, everyone.
Yeah. Hi,
Hello.
hi, Mariella. So just to give
Hello.
everybody a bit of context, Mariella is currently on a run of night shifts.
Yes, I am.
Yeah. And we're just asking Mariella, so how does your roster currently work? Are you being rostered or are you picking up extra shifts?
Well, at the moment, I'm actually picking up extra shifts because some of my colleagues, unfortunately, aren't well, and they've actually come down with the virus themselves. So I'm doing an 8-shift week. So that's more than a week, actually. And so I've been doing 2 mornings, 2 afternoons, and 3 nights. Is that?
Okay.
Yes.
All right. And
No, and 4 nights. 4 nights. Sorry, that's 8 shifts. Yeah.
yeah. And
So
the
that's quite
staff that are coming down with the virus, are you finding they're getting unwell or are they just getting flu-like symptoms?
So it depends. Like one of my colleagues, she's got just a really bad cold. Like she's got really bad flu symptoms, but others are a bit worse. So they're actually at home in bed. They've done the COVID swab, and they've all tested positive.
Yeah.
So
Wow.
they can't come to work, obviously, and that's for a minimum of 2 weeks. And after these 2 weeks, they'll have to have the swab again, and then obviously depending on how they feel, they might come back to work if the swab is negative, obviously.
Yeah. Okay. No troubles. All right. Well, just before we begin, we'll just do a little introduction. My name is Brad. I'm a nurse as well. I'm currently working in Australia. I work in both emergency and intensive care. I
Okay.
also run Bundle of Rays. Bundle of Rays is a nursing education company, and we focus on virtual reality, and we use VR and augmented reality to teach clinical skills, to upskill nurses. And part of our education business is that we run a podcasting show which is called Reality, which is obviously what we're partaking in here. If you don't mind, Marielle, if you could just introduce yourself to everybody.
Yep, sure. So hi. Well, as you know, my name is Mariella. I live in Italy, in the north of Italy, and in the Lombardy region. And I actually graduated only 3 months ago from university. So I'm a fresh nurse, let's say. I've only been working for 3 months, and I'm currently working in a general medicine ward. And everything was completely normal up to 3 weeks ago, when my ward also became a COVID ward, like all the rest of the hospital I work in. So
Wow.
yes, it's something I did not expect in the first 3 months of my career, and probably actually I didn't expect it in my whole career, but it happened. Here we are.
Yeah, the universe has really thrown us a curveball, that's for sure.
Yes, yes, it
Yeah.
has, and no one expected it.
So it's one thing that there has been a little bit of chatter as well here in Australia, because our new graduate nurses have just finished as well, and they're just coming into the workforce, and there's a little bit of apprehension about the support and
Mm.
obviously the education that we can give to new nurses during this time. But I imagine it's just all hands on deck for you.
Yes, and it's actually the same thing here. Actually, what happened here, lots of new nurses should have been graduating in April, but they made them graduate a month before. So they graduated at the beginning of March, and from Wednesday, so that's in 3 days' time, they're going to already be in the wards with these COVID patients.
Wow.
So yes, that's quite a lot to take in when you're really new. Yeah, new to the
Wow.
actual field. Yeah.
Yeah. Okay. So before we get further into the conversation, I think it's really important that we acknowledge exactly what's happening in your area.
Yes.
I just looked at some of the statistics around Italy, and to be honest, they're a little horrifying. So, currently, you have 53,500 cases and 4,825 deaths.
Death. Yeah.
And globally, across the BBC and CNN, yesterday it was announced that Italy had nearly 800 deaths in one day.
Yes, I know. That was yesterday.
That's right, yeah. The efforts of what we see here on the other side of the world is nothing short of inspirational. We're seeing pictures and we're reading and hearing different stories about what is happening with the nurses on the front line. So before we even go anywhere, we just want to congratulate you. And being such a new nurse, you should be really proud of what you're doing.
Thank you. Thank you very much. Yeah.
No worries.
Thanks.
So as we begin, can you just give me an introduction to how COVID came into the hospital system as you've seen it?
Well, it came in, I wouldn't even say slowly. All of a sudden, everyone was COVID. Like we started hearing about it obviously from China, and then slowly it started arriving here in Italy, and in particular in one province, the province of Lodi, and it's always here in the Lombardy region. And then all of a sudden, my hospital, one complete floor was dedicated to these COVID patients. And then in like 3 weeks' time, the whole hospital was full of these patients. So it just burst out.
Mm,
um, we I think we didn't really have time to realize what was happening, and all of a sudden it was happening, and there were no more places in the ICU units, no more ventilators, and even the equipment. We have to actually ask the anesthetist when we can use the equipment, because obviously it depends. As we don't have much, it depends on who we can use it on. Does that make sense?
yeah, absolutely. Yeah.
Yeah. And obviously that's very sad, because when you see someone who's 83 years old and they decide that no, we can't intubate this person, whereas in a normal situation, that person would surely be intubated and they could happily live maybe 5, maybe 10 more years. And that is heartbreaking.
Mm.
Um, yes. So, yeah.
So
Yeah.
if at any time during this conversation you need to take a pause, you just let me know, okay? I don't,
No.
yeah,
Okay. Thanks.
no worries. We're here just to
Thanks.
hear your story. I want to make sure we take
It
care of you.
was, I'm much better now, but like if we'd had this conversation a week ago, I don't think I would have been able to talk to you.
Yeah.
It, yeah, I sort of not come to terms with it, but now I'm a lot more positive, and I know I just need to be strong, and yeah, that's what people need from me, and that's what I must give them in this moment.
Well, the world is with you, Mariella. You're not
Thanks.
alone. So how are you coping? What kind of strategies are the nurses using at the bedside, on your lunch breaks, after work? What is the team doing to?
We don't have lunch breaks. It doesn't exist. No. Um, what the worst? I don't know. We don't really have coping strategies as a group. I suppose we've never really needed them,
Yep.
and so no. And also, there's not many of us now. We finish the shifts and we're really shattered. So all we want to do is get home, and we never finish our shifts on time because there's so much to do. There's so little staff, and one of the biggest problems I find is never being able to shut off from coronavirus, because it's at work, and when I leave work, it's outside, it's everywhere. Everyone talks about coronavirus. It's on the news. Obviously, at home with parents, you talk about that. I receive loads of texts every day, which is very nice. But obviously, everyone wants to know about coronavirus, what I think about it, what the situation is in the hospital. And I just feel I can't get away from it.
Mm,
And the worst thing, though, is I dream about it. I dream about hospital, about getting undressed in my PPEs, and yeah.
yeah.
So that's the most difficult part. Well,
Yeah.
one of, yeah.
Fair enough. And one of my questions later on was going to be in relation to staff. I may as well ask that now. How how many staff do you have? Like, what if you had to take a guess at the percentage of people that were off with corona or unavailable? What would it be?
I can't tell you. I really don't know what the percentage is. I know it's very high, and there's not enough staff in my ward. We've got 11 patients, and usually there's one nurse and one auxiliary, which is not enough. Also, because these people need to be constantly monitored. Because what happens, some of these people, they look fine, and all of a sudden, their situation aggravates, and they need care, immediate care. And another big problem is with the fact that we have to get dressed to go in the rooms. Obviously, outside we've only got the auxiliary, and they're the only person who can pass us what we need. So obviously, that's a big waste of time. If there were more of us, everything would be much quicker
Mm.
and it would be easier. Um, yes, it's just
So,
really hard physically and psychologically.
yeah, so
Um,
preparing medicines and doing
yes,
patient cares and
yes,
those type of things, it's very time consuming because of the PPE.
yes, yes, definitely.
Yeah.
And yeah,
Okay. No troubles. And how many beds in total is your hospital?
lots. I wouldn't know. There's
Okay.
lots, and also now the hospital has been completely rearranged. Like when we decide, what no, when they decided that my ward was going to become a COVID ward, we had to go around the hospital looking for empty beds to fill up our ward because we had no more beds, and so many beds are occupied, like even also in the emergency rooms, whereas before they only had one or two beds. So the actual equipment is missing as well.
Yeah.
Um, and also everything has to be sterile, mono patient. Whatever goes into the room can't come out. Um, it's it's a lot of things, lots to think about, and we're missing the basics.
Yeah.
For now,
So,
we're fine, but the system is going to collapse eventually.
yeah, before we talked, I just wanted to make sure all the statistics and things that I'm reading about Italy were correct, and none of the graphs seem to be going down.
No, no, they aren't.
Yeah.
They aren't.
And listen, globally, there's a lot of conversation about PPE. What to wear, when to wear it. Do we have enough stock?
Mm-hmm.
How is your hospital or your region dealing with the PPE?
Okay, well, no, we don't have enough stock. And fun enough, like companies are donating lots of gloves and anything they have to the hospitals, like masks and everything. So you see different nurses with different type of equipment, different color gloves, different color or types of masks, because everything is coming in from everywhere outside the hospital, which obviously is good, but it's not going to last forever. And so we have to wear our PPEs before entering the rooms. So what we do, we put on a single-use surgeon's gown, and then we have feet covering, a hairnet, a visor, FFP2 masks, and 2 pairs of gloves. So this is the minimum required to go into the rooms. And then when we come out, we have to take 1 pair of gloves off. We disinfect our hands, and then we put another pair of gloves on, so to go back into the room and assist the other person, because each room has two patients.
Wow, and they're just standard rooms, aren't they? They're not negative pressure rooms.
No, 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 standard, yeah.
Standard. And um, so face visors, I'm just trying to picture that. That's extremely time consuming.
That's time consuming, and it's very hot. It is extremely hot. Yes, and it's painful. So I've got like cuts above my ears. That's where my masks, where the cords from my mask touch down on my ears. And then the visors, they really press hard on your head. So when
Yeah.
I take everything off, obviously I've got marks everywhere. My face is completely red. I'm completely sweaty. Um,
And
but
so toilet breaks would be at a minimum also. Sounds crazy.
Well, to be honest, they were at a minimum anyway. I never had time to go even before coronavirus. But yes, now it would be quite difficult.
Yeah,
Yeah.
that's nursing.
I
Yeah,
know.
yeah, yeah, yeah.
Yes.
Okay, all
So
right.
that's
So
not my biggest concern.
yeah, fair enough. So when these patients deteriorate, have you had to intubate anybody on the ward, or is it
No,
no?
no, I haven't had to do this. No, I've never seen an intubation up to
Like,
now.
yeah,
Yeah.
okay, no troubles. And your patients that deteriorate, are you using a scoring system that sort of gets them referred to intensive care, or?
No, what happens? We have the anaesthetist coming around in the morning, and they actually decide beforehand what if this person should aggravate. This is what we're going to do. So we already know who is eligible for what.
Wow, so
Okay.
you just make that
Yes.
call in the morning, essentially just put a tag on each patient to say yes, no.
More or less, yeah. So this is what they're doing at the moment. Yeah.
Yeah.
Also because obviously the doctors at the moment they're being called every single moment during their shift, and obviously if they can prevent being phoned for cases that aren't going to be intubated anyway, obviously that's less time consuming. Does
Yeah.
that make sense?
Yeah,
Yeah.
yeah,
And
absolutely.
also we've had loads of doctors come in from doctors already retired. They've loads have come back in, yeah, to help out. Yeah. And also from other clinics. So maybe clinics who maybe they're not no, sorry, as operations, they're not being carried out at the moment. So
Yep,
loads of clinics sort of don't have work at the moment. So
yep.
what they're doing, they are actually sending their nurses and their auxiliaries to the hospitals, like in aid.
Yeah, okay, yeah. Yeah.
That and obviously that's great. Yeah.
Yeah, fantastic. Yeah, I actually spoke with a Spanish doctor who's working in Madrid in emergency 3 or 4 days ago, and he was saying that cardiologists and neurologists are coming to emergency to help because
Yes.
there's very few normal patients.
Yeah. True. Yeah.
Yeah.
Yeah. True. Yeah.
And
Yes.
is that a sort of a phenomenon you're seeing at your hospital? Have you noticed that your other nurses are saying that there's very few normal patients, or is your COVID ward the sort of only COVID area?
Oh no, the whole hospital is a COVID ward, COVID area. Also, it is quite incredible. But I heard a doctor talking the other day, and and he was saying it seems as if the stroke percentage has gone down. So what has happened? Why has it gone down? It's quite weird. And what they are saying also, there are lots of less casualties because we're on lockdown, so people can't go out.
Yeah. So
So obviously,
less
yes, if people
trauma.
can't go to the, yes, less trauma. Yeah, people can't go to the mountains, people can't go skiing, running, or whatever. Yes, a lot less trauma.
Fascinating,
Um,
isn't it?
well, that's lucky, fortunately. Yeah,
Yeah, that's right. Okay,
really.
so from your day, you know, when you get up in the morning, are you sleeping near the hospital? Do you live near the hospital?
Yes, fortunately, I live 20 minutes from the hospital, so that's
Yeah.
great. Yes.
Okay, and obviously there's nobody on the streets there.
Oh no, nobody at all. I'm looking outside of my window right now, and there's not one single person. Yes, it's really strange. It's weird.
Yeah,
Also, when
and
I come home from work, I really get home like in less than 20 minutes, in 15 minutes, because there's no one around, which obviously is great.
yeah,
And from tomorrow, they are going to implement even stricter measures. So all companies are shut from tomorrow.
wow.
Yeah.
That economic impact in your area,
Oh,
have you got friends who are not nurses? Have you been speaking with them? How are they coping?
well, some of my friends are still working because they've got the possibility of doing smart working, so from home.
Yep,
But others obviously don't. And unfortunately, the time they are sort of getting off at the moment is going to come out of their holidays,
yep,
which obviously they're not happy about. And another big problem is that in Italy, our big holidays are always in August. Usually the whole of Italy shuts down for at least 2 weeks in August for holidays. But the problem is now, with so many people having to take all their holiday leave at the moment, they're not going to have it in the summer. So the economy is already having big problems, but it's going to have even bigger problems because less people are going to go to the sea in the summer. So it's going to be a big problem. It already is.
Yeah. Yeah. The word recession and depression associated to the
Yes.
economic impact of this is
Yeah.
definitely married up, but that's something that we can see in the future.
Yes. Also, yes,
Um,
as you said, depression, that's going to be something really big. Apart from people at home at the moment who are forced to be at home, obviously, but people who can't be near their relatives who are dying, that's going to come out eventually, and they're going to be suffering, and depression because of the economy. So it's going to be really hard. I don't know when we're going to actually come out of it.
Yeah, seeing the news here in Australia or from the US, I think the world doesn't know just as yet, unfortunately.
No, yeah, no one does. Yeah.
So you live 20 minutes away. One big thing that the nurses here in Australia are fearing at the moment is, we're on the front lines. Essentially, this is a war against COVID, but the nurses are the soldiers, but we didn't really choose to be here. we didn't sign up
I know.
for war, and
I know.
that war we can take home to our families. Our phone. I notice that a lot of nurses in Italy are putting their phone in a bag and
Yes.
being smart about how to manage the transfer of the virus. But are a lot of people showering at work before they leave, or is there a lot of apprehension about taking the virus home to people's families?
There is. There is. So what we do, we actually get changed before leaving the ward. We get changed, we put clean clothes on, and then we go to our lockers and we change again, and then everything gets washed. And obviously our uniforms are washed every single day. And lots of people actually aren't going home, lots of nurses. And this is another big problem. Yesterday I was speaking to a colleague of mine, and she knows a nurse who's married to another nurse, and neither of them are going home to their children because they're just too scared. So they're both really, really down. Obviously, they haven't seen their children for 3 weeks.
Wow,
And
that
yeah,
made the hairs on my neck stand up.
yes, yeah. And I think whoever has children can sort of
Yeah,
understand that, but even who doesn't actually, yeah.
yeah. Well,
It's just heartbreaking.
I have a 1-year-old baby, and my wife is 30 weeks pregnant.
Oh, congratulations.
Yeah,
Oh,
yeah,
in
yeah,
good
yeah.
time.
Busy times,
Yeah.
but this bloody
Yes.
COVID, it's getting everyone. So,
Yes.
but we just have to be smart with what we do. We can only control the things that we can control.
Yeah, of course. Yeah, I live with my parents, and my dad is actually he's a bit fragile. So obviously, yes, it is worrying. And so I'm the opposite side of the table. I try not to sit next to them on the sofas, and yeah, small
Yeah,
measures. I do think that if you have to get it, you're going to get it. But
yeah,
I'm still going to be careful.
yeah. Of course, of course. Now, what is the army doing in your area?
So the army is so they are carrying out checks on people to find out why they're out. So we have some special forms that we have to sign. We have to write down what the reason is that we are not at home. So obviously we've got work reasons, we've got health reasons, or if you have to go grocery shopping, that is all fine. But for any other reason, you should be at home. So the army is doing this, and so people must have a valid reason for leaving their house. No other reason is permitted. Also, the army at the moment is involved in with the transport of corpses to other regions for cremation. This is happening especially in Bergamo because the crematoriums and their cemeteries are just completely full.
Mm.
So this is something else which is sad. You've probably seen photos and videos of the army trucks
We have, yeah.
filled up, filled with the corpses.
Yeah.
Harrowing. Yeah, and that's another horrible thing. So your grandfather or whoever dies, and you can't even say goodbye to them for the last time. You can't even go to the hospital. You can't organize a funeral. It's just surreal. It's just oh well, they're dead. Can't do anything about it. It's just horrible.
Mm.
And yeah.
So you have 0 visitors to the hospital?
Zero. No visitors at all. So
Okay.
these poor people are in their rooms on their own or with someone else, and that's the only person they see the whole day, apart from us. But as you know, we go in completely covered, so they can't even see if we're smiling, if we're crying. Like, it's yes, and obviously they're very lonely, and being old people, most of them don't have phones, so they can't even phone home, and they're just isolated.
Yeah.
Mm.
Any innovative entertainment options? You know, do you have the radio blasting or TV or?
No, each person has their own television, but
Yeah.
I've actually noticed that none of them have interest in watching it. Everyone just seems really, really down. Um, yeah, they're just
Mm.
worried. And another really sad thing is usually if husband has the virus or wife has the virus, also the partner has it.
Yeah.
So maybe the one who's the most severe is in hospital, but the other one's at home. But then again, the other person is at home on their own because no one can go and visit. So that's just extra worry, not what you need when you're an old person and you're ill.
And I'm just thinking that out loud, because even if their loved one wanted to phone them, if they didn't have a phone, it would be
Mm.
extremely difficult for you to facilitate a phone call.
Yes, yeah, it would be. Also, apart from really don't have time, we really don't have time, and nothing can go in. So we could put it in a plastic bag, but
Yeah.
it would just not be feasible with 11 patients.
Yeah.
Mhm.
And so these patients that you have, you know, are they on oxygen, or are they all requiring oxygen?
Yes, they are. One wasn't requiring oxygen, and not anymore, and he didn't have a temperature anymore, like for 4 or 5 days.
Yep.
So he repeated the swab, and it was negative. So he went
Hey,
home today. Yes, yes. So obviously very happy about that.
I suppose
Yeah.
that's that's really important, isn't it, to take the wins when you win?
Well, you must in this situation. You must. Yeah.
Yeah. Oh, that's fantastic news.
It's.
So
We'll get over it. We'll get over it.
exactly, that's right. And you know,
Yeah.
in a way, this is like a war, and we just have to knuckle down and do our best. And clearly, that's
Yeah.
exactly what you're doing.
Yeah.
So while we're talking positives, what do you think you're doing well in the hospital collectively?
My job. My job. My job. That's what I always wanted to do. I do my best. I keep positive. I try to lift spirits up. I try to make these people laugh. I'm just there. I try to listen to them. I don't have much time to do it, but I try to invest the little time I do have in listening to them, because most of them just really want to be listened to. Yeah. Sometimes they ask you what's going on outside, and you're like, well, outside it's the same as here. Everyone talks about coronavirus. So you try and talk about the weather, and they're usually quite happy. Yeah.
Yeah, well,
So,
the area that you're in pretty much is on the edge of Lake Como, if I'm correct.
oh yes, we are. Yeah.
Yeah, I'm
So yes, Lecco is the other branch of the Como Lake.
yeah, yeah.
Yes.
It's a beautiful part of the world. I have been there.
Yes.
Yeah.
Yeah. Oh, great. Yeah. I've been to Australia.
Ah, fantastic. Yeah.
Yes, I went there on a gap year.
Yeah, lovely. Yeah, well, the world is a small place these days, and when you look at the distribution of COVID, we can get in a tin can and jump in the sky and fly around, and I feel like in a way that has hurt us with COVID,
Yes,
sadly.
yes,
Yeah.
it's true. It all backfired. Yeah.
So I think it's really important, even you yourself as a new graduate working on the floor in the ward, that we have these conversations from one nurse to another to really understand how we can improve or to provide best practice for COVID. With your nursing and what you see with the hospital policy, um, talking to your patients, what can we learn in Australia from what you're doing? We're about 4 weeks behind your numbers. Our trajectory isn't too different, much like England at the moment. What what can we take away from the experiences that you've seen?
Um, be careful. I don't know. I really wouldn't know. I do think that obviously prevention is important. Um, it doesn't seem as if this lockdown has diminished the numbers of coronavirus patients, but it's definitely made the increase slower.
Yeah,
Um, Surely we should learn that it could happen to any country, and obviously we should take drastic measures immediately. Everyone should, to prevent this virus becoming out of control, which is what has happened here.
yeah,
And definitely all countries should invest more heavily in their healthcare system. That's one big problem here in Italy. And definitely be prepared with surgical masks and ventilators. That's definitely something good. And something nice that's happening here, there are loads of GoFundMe accounts for various hospitals.
yeah.
And thanks to donations, loads of hospitals, especially the small ones, have been able to put up like campsites with loads of beds in them, and also to buy new equipment, new beds, and new ventilators. That's the most important thing.
Hmm,
Um,
fantastic. All right. Well, I think, is there anything else you want to add?
Anything else I want to add? Um, no. Take care of your loved ones. No.
Okay.
Yeah, I think we should. Yeah, just be nicer to each other.
All right,
Yeah.
Mariella. I can't
Yeah.
thank you enough for taking the time out of your day. What you're doing is remarkable. The world is watching, and we're watching with awe. We're going to take a deep breath. We're going to take the things that you're doing and deliver them to our patients. For me, you see the idea that you have a patient dying in a room on their own is just heartbreaking. And to hear you talk about listening to that patient, being there for them, is extremely inspirational. So thank you from one nurse to another. You're doing a good job. You go and get some rest. Are you going back to work tonight?
Yes, in 1 hour.
All right, you have a cup of tea, or you do whatever it is that you do. You give your mum and dad a hug, or don't hug them. You give
No,
your mum
I'm not
and
going.
dad.
I'll hug them virtually, yeah, from far away. That's what I've been
Yeah.
doing for the last 3 weeks.
All right. Well,
Yeah.
whatever you
Well,
do,
thank you very
you
much.
take care. No trouble. We'll see how things play out. I said to the Spanish doctor that we interviewed 4 days ago, perhaps we can touch base with him again in a week if it's okay with you. We may do
That's
that.
fine.
Yeah.
Yes, that's
just
fine.
just to get an update on what's happening. It looks like I'm trying to secure a doctor from America, and we'll also talk to a nurse here in Australia. So if we have a consistent avenue for conversation, it should provide some interesting content for people to stay up to date on COVID.
That's great. Thank
Okay,
you for your
Mariella,
work.
you have a good shift. We send our
Thank you
love,
very
and
much.
you take care.
Thank you very much.
No
And
worries.
thank you. It was really pleasant talking to you.
Thank you, Mariella.
Bye.
Bye.